My name is Dayna, and I'm here to share with you my ovarian cancer story. Today is May 11th, and I was diagnosed with ovarian cancer stage 1C on March 9th. Back in November, on my left side, I began having this pain in my digestive area. I noticed that it would get worse if I drank coffee or tomatoes or orange juice, acidic stuff. I ended up trying a bland diet for a couple of weeks, and with no avail, I ended up seeing my family practitioner in December. She said that I probably had gastritis and prescribed me Prevacid. I was supposed to take this for 3 months, um, a half hour before each meal, and this would combat the acid that I had building up in my digestive area and thus would fix me. She wanted to see me in a month for a checkup. Well, after a month, I was still having problems. Every time I would eat or drink coffee, it would hurt. I did notice that if I took some Advil, I would feel better. Advil or Excedrin or Tylenol, stuff like that. So when I went in for my checkup, I told her that it wasn't working, and she said, okay, just continue it for 2 months. I'm like, all right, whatever. I just decided to tell her, that I am almost 31 years old. I've never been pregnant, and looking into a few things, I think that I might have endometriosis. She said, hey, that's a very good idea. Let's get you in for an ultrasound. Well, I went in for an ultrasound a couple weeks later, and that came back showing a mass in my pelvic area. So they wanted an MRI done. The MRI came back showing two masses in my pelvic area, pretty big masses. The MRI did state that the mass did not definitely look benign, which means they could or could not be cancerous. They couldn't tell from the MRI, so they wanted me to see a gynecologist for removal of this mass. I made an appointment, and the day before the appointment, my left calf muscle felt really sore, almost like I had a Charlie horse. That in the middle of the night, and it just kept going throughout the day. Um, I ended up going to the doctor, the gynecologist, and he did a pelvic, and he said he could feel it immediately, and he was shocked that nobody had ever felt this before. Well, I had always just had my paps done at my family doctor, and they would send the results off to the lab, and they've always come back clean, negative, nothing suspicious, so I never really needed to see a gynecologist. Um, I he the gynecologist wanted me to see a gynecologic oncologist because of what the MRI said, having the masses not totally look like they were benign. So I made an appointment with them, and it was scheduled for March 1st, which was about 2 weeks away. And on Friday, which was the day after I went to the gynecologist, my leg still hurt really bad, and it had actually started to swell up, sorry. And I ended up going to my doctor, and she was very concerned. She thought I might have a blood clot, so she sent me to the emergency room for an ultrasound, a Doppler, on my leg, and it came back negative. There was no blood clot, so she had no idea what was going on. She gave me 2 days off of work, told me to relax, keep my feet up, and if there's a problem, go to the emergency room. Well, I took my 2 days off, and I absolutely did no running around. I elevated my leg and relaxed. Well, Sunday I worked, and after work, I ended up going to the emergency room because my leg was swollen so bad, and it hurt like you don't even know. Advil wasn't working, Motrin wasn't working, nothing was working. At the emergency room, they checked for electrolytes and kidney function and blah blah blah, and everything came back normal. The only thing that they were a little concerned about was my white blood cell count was elevated. And they said, well, this mass in your pelvic area is probably pushing on a nerve or something which is causing your leg to swell up. They said if you have any further problems, go see your doctor. Okay, well, my doctor told me go to the emergency room, and now the emergency room is telling me go to the doctor. So I ended up calling the oncologist the very next day, and I told them, I went to the emergency room, and I asked them that if they can see me sooner rather than on March 1st, so I don't have to spend too much extra time off work with my leg issue. And they were able to get me in the very next day. They did a background test, asked me about my family history with cancer and a whole bunch of stuff. And, my aunt on my mom's side, she had breast cancer, but that's it. There was nothing ever besides any other cancers running in my family. So, he said it's probably not cancer. He said he's 99.999% sure it's not cancer, and referred me to a fertility specialist because he did know. I told him that if I could salvage my, reproductive areas, I would like to do so, just in case I do decide that I want to have children in the future. And I called them the very next day, explained the situation with my leg and how I had just seen the oncologist, and they referred me to him, and they ended up getting me in that day. Um, There, they ran a whole bunch of tests. They took like 14 vials of blood, and when the results came back a couple days later, they called me and said, "Well, we definitely want to get you in for surgery, um, an exploratory laparoscopy, or however you pronounce that." I had elevated CA-125 levels and elevated white blood cell counts. Well, the surgery was scheduled for March 9th. They were going to go through my belly button and two right cuts like right on the side of your belly, and they were just going to go through and pull out a little piece and see what it was, and hopefully get it all out. Well, while they were in there, they pulled a piece out of the mass, and they sent it up to the lab, and it came back cancerous. So the doctor ended up calling the oncologist and said, "Okay, you need to come finish this because it is cancerous." And it was pretty shocking to everybody, to the doctors, and to my parents and my fiance and everybody, because cancer doesn't run in my family. Um, when I awoke, they told me that I had stage 1C ovarian cancer, that they pulled a tumor the size, a little bit bigger than the size of a softball, out of me, which is very alarming to me because I'm only 5 foot and I weigh 100 pounds. So something, that big was growing inside of me was pretty amazing to me. Excuse me. They said that had I waited any longer, I would have been a stage 2 for sure. Uh, and they took out lymph nodes going all the way up to my aorta to make sure that it hadn't spread, which thank God it didn't. So I ended up losing my left ovary and my left tube, um, which, okay, I guess that's fine. It's better than death. So, yay for that. And they did want, just in case, they dropped any cells on accident or whatnot, I am going through 6 rounds of chemotherapy. I just did my second one a little over a week ago. And as you can tell, I have a little bit of hair left. I decided to shave my head, I want to say it was like 3 weeks ago. It had begun to fall out on Easter, and I would sit there and I would pull it out like this and go, "Hey, look, my hair's falling out." Okay, so it wasn't really falling out, but it was definitely coming out easier than I would have liked, so I just shaved it off. And I do have a video of that, which that'll be posted pretty soon. Um, Chemo's treated me pretty good. I don't even feel like I'm on chemotherapy. Like, I get Taxol and carboplatin, or platin, however you want to say it. It's like an 8 to an 8.5 hour treatment every 21 days, and then I have to get blood work taken uh, the week after chemo and then the week before chemo. So I'm getting blood work taken all the time, it seems like. But as for the side effects of chemo, I really haven't experienced any. Some say I'm so lucky. I'm currently working still. It's a high volume retail store, GameStop actually, one of the higher volumes. And it's pretty stressful there sometimes. It can be, but my staff has been awesome. Um, and I haven't experienced much of anything. I have chemos on Monday. Tuesdays I'm a little bit like poofy and a little bit pink, caused from the steroid that they give me during the chemo session. And then but that's all on Tuesday. Like the next day is just fine. Wednesday I feel the fatigue. I'm a little bit tired. And a little bit nauseous, not necessarily nauseous, but I just don't want to eat. And then Thursday, I don't have much of an appetite. I just don't want to do anything on Thursdays, really. And that's been consistent for the past two chemos. But other than that, I feel fine. So I'm extremely blessed. Um, I'm noticing that my hair is getting thinner, and my fiance actually pointed that out to me yesterday. Actually, I took off my wig. I did buy a couple wigs. I took off my wig, and he's like, "Wow, your hair's getting thin." Oh, thanks, dude. Thanks. I appreciate that. So, anyways, my hair is getting thinner. I do have a couple caps that I wear, and I have a couple wigs. I don't like the wigs for some reason. Like they push on my head, and my my head is pretty sensitive right now. Like even when I touch it, sometimes it's kind of sensitive. I'm guessing it's because my hair is falling out. I don't know. So I prefer to wear like bandanas and stuff like that. I haven't found a whole lot of cute ones that I like, but I'm hoping to find some soon. And that's pretty much it. I mean, if you guys have any questions, you can totally, send me a message. I will get back to you as soon as I can. But yeah, I'm 31 years old, was diagnosed with ovarian cancer, first one in my family that I know of ever, and I'm a survivor.